We want to welcome you to the 8th IMPAKT conference to be held in 2016 in Brussels. IMPAKT is a unique conference which brings together clinicians and scientists to discuss the latest developments in breast cancer treatment and investigation. Philippe, who are the people that this conference is aimed at?
I think this is really a conference that speaks to young oncologists and young translational researchers who really have an interest in what are some of the fundamental biological questions in breast cancer, what are some of the recent technological advances and the latest science, and how we can apply that to develop new clinical trials, new research projects that really deliver new treatments to patients to improve their outcome.
And so this is a conference that's designed at trainees and young scientists as well as established clinicians.
Absolutely. I think it really ranges, and it's a unique meeting because it's a relatively intimate venue. There's only a single track that's ongoing. There's lots of opportunity for discussion and interaction between the faculty and the speakers and the audience members, and those sort of conversations carry on even in between the sessions. And there's a training course that happens before the meeting that really focuses on some young investigators and gives them a chance to meet with some experts in the field and really learn about the latest advances and how they can develop their own research careers.
There's a certain amount of guesswork as to what are going to be the hot topics, but it's undoubtedly so that immune therapy is going to be a big topic, so we have a session devoted to that. And then we're seeing so many new approaches in ER-positive breast cancer with combination targeted treatments that we have a session devoted to that as well. What else do you think will be the hot topics?
There's no doubt that immune therapy is something that's generating a lot of interest, and that'll be an important focus of the meeting. And also looking at the molecular characterization of ER-dependent tumors, what we've sort of learned from some recent studies looking at the chromatin landscape and some recent clinical studies that are applying new drugs. There'll also be a focus on looking at some novel drugs that are in early phase clinical trials and how those might translate to later phase studies in the future. And different sessions that are looking at liquid biopsies, genomic characterization of both somatic alterations and germline alterations, and how that might be applied to patient care.
And we plan to do that in a tumor board type of setting to really try and make the science applicable to daily clinical practice. So I think it's going to be a fantastic meeting, and we really urge you to put this one in your diary for May 2016.